A big thanks to everyone who's always commenting on our videos and who even asks questions to babybrunch.co.za. We promised we'd bring the conversation around allergies back, and this time we call it Allergies and My Baby. Now, we're all suffering. I'm sitting here with red eyes. I've got a little girl at home on a nebulizer, and there is no one better to bring back than Dr. Tshegofatso Mabelane to chat to us about allergies in our home, in our children, and also what we can do about it. I think the one question that came up from a lot of moms is how to treat allergies in newborns, especially, then also our toddlers and small children.
I often like to think about the allergic march, which just means that it's the progression of allergic diseases from infancy up to a certain age, but it can occur really at any age group. When children are born during infancy, we tend to see eczema, so this irritating itchy rash with dry skin that just won't go away, that makes a baby to be very irritable. And how we manage that is, we'd like to just make sure that we apply emollients. So I'm totally against soap. Sometimes you get the soap that says hypoallergenic, or it's got glycerine, or all these funny things, and we want to use it. But anything that dries out the skin, I'd say during infancy, you just want to avoid and use an emollient to bath your baby and an emollient to apply over the skin. So during infancy, we see eczema early on. And then as we move on to solid introduction, around 4 to 6 months, we then start to see food allergy. And the most common food allergens are peanuts, tree nuts, fish, wheat, that could be from cereal, cow's milk, soy. Those are the most common allergenic food that when we introduce, and a child might come up with hives, this rash that's got a bump, that's itchy, that's red, swollen eyes, or any other part of the body, swollen lip. And then if it's at its severe form, where we call it anaphylaxis, then you might see that a baby might start developing shortness of breath, difficulty in breathing, they become withdrawn. Then it's moving to a more severe form. And with food allergy, you really just want to get your baby tested as early as possible, especially the high-risk infants, so those that have had eczema, and then go on to develop food allergy. You just want to test and make sure that they are tolerating the food that you are introducing. And then as these kiddies start becoming toddlers, they're moving around and exposed to environmental allergens, then they get snotty noses. They've got this runny nose, sneezing, rubbing their eyes, like I said, more hay fever, allergic rhinitis kind of symptoms. And with those, you want to introduce intranasal steroids. And then as they get older, they might advance to asthma. So the allergic march is really from eczema to food allergy to allergic rhinitis. And then in older children, we begin to see asthma. And in those kiddies, it's very difficult sometimes to diagnose asthma, especially below the age of 6 years. But they respond very well to inhaled corticosteroids. So again, you just want to have your baby checked out to get a confirmatory test and initiate inhaled corticosteroid. So if you listen to my answer, I keep saying steroid, and I know a lot of parents just freak out and say, steroid, what does doctor mean? We all freak out when we hear the word steroid. I hate steroid presented in a bed form. So oral steroid, anything that's steroid and you drink it, it's got to be digested, goes into your bloodstream, gets distributed all over your body, and it comes up with bad side effects. So you want to avoid giving your little ones steroid in an oral form or in an injectable form. You want something that goes directly to where the problem is. So when you have eczema, you want a topical steroid. When you have hay fever, you want it in the nose. And when you have asthma, you want it as an inhaler in the lungs. And if you do allow me to just elaborate, especially with eczema, I'm very passionate about it because a lot of times, mothers or fathers, parents get this emollient that's mixed with topical steroid. And I like to give this example, and I say, when you give your little one Panado, and the doctor says 2.5 mils or 5 mils, we carry around the spoons, we measure, and we want to know how much we're giving. Yet with steroids, we often don't know how much we're giving. And when we give too much, obviously that comes with side effects. Thinning of the skin, stretch marks, all these bad things that we don't want from steroids. So when you do apply a steroid on the skin, you'd like to use a fingertip. So a fingertip of your baby would be equal to the palm of the hand. So if the affected area is on the face, and this is literally my palm on my face, so I would use about two fingertips, because the one on one side and on the other side, the affected areas only. And that you would want to use on when the baby does have that flare. And again, with proactive, so you're proactively, just to minimize the acute flares, you want to apply 2 days in a week. You could choose a weekend, Saturday, Sunday, just to delay, instead of waiting, you're proactively managing the eczema. So in a nutshell, that's what I would say.
We still have the belief that emollients could possibly help us. And so does the research around emollients, does it still ring true? Can it protect our children, or applying a cream, can it protect our children from suffering from allergies?
I hate that question. I hate it. Because really for a long time we've believed that emollients through and through, whether it's in low-risk babies, high-risk babies, that's the way to go. I am totally for emollients in babies that have eczema, atopic eczema. But there's been there's research that's been done where one looked at, a researcher looked at about 1,435 articles. So we call this a meta-analysis, and just really critiquing all those different articles. And what comes out is that in your high-risk babies, those that obviously have more hereditary, because eczema is familial, it comes from the family, it's hereditary. You would want to use emollients, but unfortunately it doesn't prevent, like we used to believe, it doesn't prevent one from getting eczema completely. It may delay, the studies have shown that up to 1 year. So you may delay your baby from getting eczema for up to 1 year, right? And of course, for the low risk, even up to 6 months of developing. So yes, for a long time, we've believed that's the way to go. That's how we get to prevent. But no, it doesn't 100% prevent. The babies just tend to get it later on in their lives rather than earlier during infancy.
Prevention is still better than cure. And so is there anything that we can do around the home to prevent allergies?
Okay, so I'll take you through a walk. It depends what you're sensitized to. So I'll give you an example. Environmental allergens in the house. We've got pets, we've got mold, we've got house dust mite, we've got cockroach. And believe it or not, cockroach in patients that have asthma, they tend to have more severe disease and very difficult to manage asthma if they're sensitized to cockroach. So I'll take you through a walk, and we can just start literally in the bathroom. And in the bathroom, you just want to keep, I'll say, everything dry and clean. So when you walk in the shower or in the bath, you'd see there's black things along the tiles. That's mold. And you can just use Domestos or Jik. You can use that once a week just to clean, and that minimizes mold. And you just want to keep everything dry, really, just to minimize the load of a mold in the bathroom. And then let's walk. I'll take a walk into the bedroom. Okay, so in the bedroom, there's more your house dust mite. And what you'd like to do is with the curtains, especially with the thick curtains, with books, with furniture, with carpets, that's a lot of house dust mite. And one could get a HEPA filter, HEPA filter, a vacuum. It doesn't have to be expensive, any brand really, as long as it's a HEPA filter. And you can use that to literally just vacuum the floor every other day, and vacuum your curtain, vacuum your mattress every 3 months. And house dust might die in very high temperature or very low temperature. So if you've got some fluffy toys in the bedroom, put them in a plastic once a week, throw them in the freezer, because that's -4 degrees Celsius. Overnight, get them out the next day and wash them normally. And the house dust mite that's a way to kill house dust mite. Okay, you're bedding your pillowcases, your sheets, you just want to maybe use high temperature. You can, when you wash in the washing machine, use a high temperature hot water. And because I'm very practical, and sometimes, some people don't afford to have a washing machine that has that hot option, and they ask, doctor, what do we do? You can boil water and pour hot water over your bedding, let it soak a bit, and then wash it afterwards, because you just really want exposure to that high temperature or very low temperature. So in a nutshell, that's what you want to do in your bedroom. And then we can take a walk to the kitchen. Yes. There's mold, obviously, in the dustbin. And you just want to make sure that you empty your bin as frequently as you can. You keep everything dry and clean, because when it's clean, then you're also minimizing cockroaches as well. When you're cooking, you can just put the cooking fan on, because that minimizes humidity. So you want to minimize humidity as much as possible. Open your windows. Instead of using a tumble dryer, try and hang your clothes. But then again, living in Gauteng, there's high pollen. It's spring. What do? You just try and hang out your clothes until they're dry. As soon as they're dry, you bring them back in, because you don't want them exposed to pollen for a long period. So yeah, in a nutshell, keep everything dry, clean, and not humid.
We all feeling it at the moment. I mean, I know of 4 people at work without a voice. I know of someone that has got bronchitis. I know I'm suffering with red eyes. So is there a difference between allergies and flu?
The easiest way to tell the difference between flu and allergies is that with flu, it's usually short-lived, whether it's viral or bacterial, and it would resolve within a few days. Your baby would be miserable. They might have a fever or not have a fever, but they would resolve ultimately. While with allergy, because of the chronic inflammation, it's often persistent, and it's histamine driven. So where there's histamine, there's itch everywhere. So there's itchy eyes, itchy nose, blocked nose, runny nose, teary eyes, and funny sounds. Rabbit nose. Sometimes you see babies just doing this as if they're like a rabbit, scratching their throat, post-nasal drip. And I mean, with allergies, it also comes up with physical manifestation changes, hey? Because dry lips, because they're obstructed, they're not breathing well. You might see them breathing through the mouth. Darkness around the eyes, we call it allergic shyness, and so on. There are other, in the long term, bad signs that you see a child developing as they get older: a line over the nose from rubbing frequently, elongated face, and so on. So that's intermittent, frequent symptoms that I would definitely say it's mostly allergies.
Well, thank you so much for your time. With all of our snotty noses from this side, we'll take your advice. If you want to follow Dr. Tshegofatso Mabelane, you're welcome to do so in this post right now. Also, find more information about our previous conversations that we've had around allergies. Find it on babybrunch.co.za.